In today's Health Smart, we are talking about breast implant illness, joint pain, chronic fatigue, hair loss, and chills. The list of symptoms for BII goes on. But today, the thousands of women suffering from it insist awareness, understanding, plus medical knowledge, support, and relief falls very short. And to help us understand what BII is and tackle what's become a global controversy is Beverly Hills plastic surgeon, Dr. Kevin Brenner.
Thanks for joining us.
Thanks for having me.
Okay, so a lot of health professionals, and especially plastic surgeons, don't want to talk about this. I guess it's bad for business, but you're here. Why?
Well, I think that's the sense of it. You know, it's interesting. Surgeons and physicians in general, we kind of take care of patients based on data that we get from studies that we read in our medical journals. And the truth is, with BII, we simply don't have the data yet. There's been no really good studies that have tackled this issue. So until we have those studies, I think people are shying away from it a little bit.
And so you're talking out about it. Why and what exactly is it?
So breast implant illness is a constellation of symptoms. This has actually been a patient-driven phenomenon on Facebook and other blogs and chat rooms, where women have come together to say, hey, I'm experiencing this symptom or that symptom, and have related it to breast implants. And it wasn't until they kind of brought it to the attention of physicians and surgeons that we started taking notice.
And this all kind of started with basically conversations on the internet?
Yeah, BII, yeah, it was all on the internet, exactly. And it wasn't until it entered our office that we started asking ourselves, what's going on?
Well, so it's interesting because I read some of the symptoms that the women are saying, but then the critics are saying, hey, they may have had those symptoms with the implants or not the implants, right?
It's true. I mean, part of the problem with breast implant illness is that many of the symptoms are very vague. Many of the symptoms are similar to other disease processes that we can have, and that's why, at least for myself, when I see patients come in the office who think that they have BII, the first step is to say, hey, you need to go to your physician and get a proper medical evaluation to make sure that you don't have another serious medical condition that could be causing depression, that could be causing joint pain, muscle soreness, things like that.
Another term we're starting to hear now is explant.
Right.
A lot of women are making the decision to have them removed because it's just not worth it.
Well, I mean, explant technically is just removing a breast implant.
Yeah.
That's what the definition is. But in terms of BII or breast implant illness, many of the patients who come into my office for explant and other plastic surgeons' office for explant, they not only want the implants out, but they also want the breast capsules out. Our women's bodies form a specialized scar tissue called a capsule, breast capsule, around any implant. In this case, we're talking about breast implants, but the same is true for any implant. And for patients who are experiencing BII symptoms, it's pretty consistent that they want not only the implants out, but also the breast capsules. Now, when I see patients for we call it explant with capsulectomy. It's also very common that I'll do other ancillary procedures with it, because if you think about it, patients came in initially for breast augmentation for aesthetic reasons often. I also have patients for breast reconstruction who've come in with similar symptoms, but it's an aesthetic operation, breast augmentation, and so I don't want to leave them with an unattractive appearing breast, so oftentimes I'll do a breast lift or maybe even bring them back and do fat grafting some months later.
And then the FDA basically recommended that breast implants now come with a boxed, I guess, some kind of labeling on it. What exactly does that mean?
Well, that came down this summer from the FDA. They put what they're calling a black box warning on all breast implants, which simply is information on the actual box that breast implants come in. And it's an interesting thing because although it's been really good to create awareness and in stories like this, and it's been covered in the media all summer long, the truth is that patients are never actually going to see that boxed warning. Yeah. The only people that see the boxed warning are the surgeons who are putting in the breast implants. So while it's great to create awareness, I think the importance of the FDA boxed warning is to put plastic surgeons like myself on notice that, hey, you're putting in this medical device. You need to make sure that you're doing your job of adequately getting informed consent from your patients before you operate on them.
Okay, so in your office, you've started something called Explant Liaison. What is that exactly?
Yeah. So in the last number of years, I've been seeing more and more BII patients come in specifically requesting explantation. I have been doing breast implant surgery and other breast surgeries for well over 15 years, and my office is really well equipped to take care of preoperative, postoperative concerns for all different types of breast implant patients. But BII patients, I've learned in taking care of them, they have a lot more things that really need to be addressed other than the typical preoperative and postoperative care. So Amanda, who is our BII liaison, we kind of teamed up together, and she's been great because she has conversations with patients, she has recommendations with patients that I don't. She's been in plastic surgery world for many years, but most importantly was a BII patient herself, went through the explantation process, so she really can speak to everything, every step of the way, the entire process. Well after I've operated on them, she's still helping them to heal and continue on with their healing journey.
Like the follow-up.
Yeah.
It's awesome. All right, thank you.
Good information. Thanks for coming in.
Thanks for having me.
All right, Dr. Brenner, again, if you or a loved one is looking for BII support or for information on explant or implant surgery, just go to kevinbrennermd.com.
Plus, tune in tomorrow night at 10 o'clock here on KTLA as we start a very special two-part series on breast implant illness and follow an explant patient before, during, and after her surgery. And did she get relief? We'll try to see if that happens. Only here tomorrow at 10 o'clock.
All right, coming up here, a new generation of angels hitting the big screen.